360 Help is an education platform. It is a part of diagnostic 360 diagnostic as well as 360 help. Help means what? See, ma'am, it's a ma'am here, Dr. Jatinder Bhatia, who is heading this particular organization. She herself believes in helping wholeheartedly. And that is why it is health education and learning protocols meant help. Now, this particular platform is basically working onto the quality management systems. It is right from 2014, and we have got enough of our faculty members, our consultants, our experts who are willingly giving their services onto from the platform of 360. We have got our team of expertise on all the 4 directions. It is north, west, south, east, everywhere covered. This Dr. Jatinder Bhatia is a director. Dr. Arora heading north, Dr. Latika from south, and Dr. Munshi on west. Now our team, if I talk about my team, we have got experts and consultants joined us. There are many in numbers. You know, they know their work well. They have got an experience over there as in professional experience, and they know how to do the problem solving. They are contributing our training teams as well as for the consulting analytical skills too. Now their unique bottom-up training aspects. What do you mean by training approach? If I say they have got unique bottom-up training approach, means they are doing a complete hand holding throughout your journey, right from beginning of signing the assignments, how to go for it, how to approach it, how to improve your plans, how to improve your quality of your work in a day-to-day life. Everywhere the hand holding is done, and this particular approach makes them successful to complete their assignments with 100% ratio. Quality speaks by itself because we are attached and we are affiliated with QMS IA training. It is with NABAT from 2016-15 and to NBQP since 2006-17. Why 360? There are many platforms. We will be working onto the same platforms, or they might be giving services into the same platform. But 360 has got its own reasons why it should be selected. The first thing is we have got 7 years of successful client list on global level. We were satisfied clients of us. 200 plus training sessions are delivered in different parts of global as in national as well as international levels. More than 5,000 people are trained under the standard or under the 360 health programs. 100% online project implementation is done and they are completed successfully. We have got more than 35 plus members, faculties who are expert in their domains, and as well as they are internal auditors as well as assessors. So 100% ISO certification rate is proving itself. Under 360 Health, we are giving a quality and technical trainings both. If I say about technical teams, just now it was in COVID area and we had delivered many of the programs related to molecular biology, immunofluorescence, flow cytometry, genetic interpretation or cytogenetics. In quality, if I say ISO 15189 is our flagship program. Under that, and there are many other programs like training on NABH, training on phlebotomy, IQC and EQUAS, and Six Sigma. There are many other programs which are there under the flagship of 360. We have recently introduced our certificate courses in the domain of clinical research. They are clinical research, clinical data management, pharmacovigilance, medical writing, medical billing and coding, and clinical document and publishing. All these programs are certificate course of 4 days. Now, please be attentive and let us hear them out. Like I'm introducing my speakers of the day today. Now, first speaker of my day today, she is a superwoman, I can say. Superwoman in the sense I'm saying you because she is the one who has never said no to any of the challenges. She has accepted the challenge before she says how. She is not knowing, but she has accepted the challenge and proved it, and it has paid it. Now see the part of it which proves it. She is the Director of Health Education and Learning Protocols 360. She is the leading team of 360 Diagnostic and Health Services. She is Executive Director of Data Cancer Group, Vice President Group Quality Operations with Newburgh Diagnostics in 2018, Consultant JPD Japan 2017. She is Director Bravo Diagnostic Uzbekistan 2016 onwards. Member Standard Writing Committee, Standard Council of Canada since 2016. Chief of Lab Services North India for Metropolis since 2009 to 14. She is Director of Final Diagnosis Noida 1995 to 2009. She is member of Healthcare Committee, FICCI, Quality Council of India, Lab Council of CAHO. Awarded, she is awarded with Bharat Jyoti Award, Sadbhavana Award, and 101 Global Healthcare Leader Award in 2020. So nothing to say more about her. I did not say any words more than this, and it herself proves her work speaks about herself. So we can assume that how the speaker will be and what a knowledge gain we will have from her. So please give a big round of applause to my director, Dr. Jatinder Bhatia. Now I'll introduce my second speaker too. He's equally good, and he's acclaimed globally. He is the one who has got a wide experience in the field of healthcare, and he has proven again onto a national and international level both. He is Dr. Ashok Ratan. Dr. Ashok Ratan is medical microbiologist by profession, and he was conferred an Abdul Kalam Award for lifetime contribution to medical science in 2018. Now he has done his academics. He has leaded positions into medical science, New Delhi. It is Jain Medical College, Aligarh, and Sharjah Medical College, UAE. He is leading. He has already given his academic knowledge over there. He has served a laboratory director care which was administered by Peho, who charged with responsibility of providing services to the 21 member countries of the region. And that is why I say he is a global leader. He has published over 100 plus research centers to peer-reviewed international journals, guided over 40 students for MD, MS, and PhD, and is named in 30 international patents. He is also the author of NBT-sponsored book published in 2000 by Churchill University, I'm sorry, it is Livingstone, and antimicrobial in laboratory medicine. He has conducted workshops on WUNET in all 9 Southeast Asian region countries of WHO, different aspects of medical education in KLWing, CMIT, AIMS, tuberculosis and lab in care of HIV/AIDS in the Caribbean, and infection in gynecology and NIPT in UAE, Oman, and Bahrain. So welcome my both the speakers, and please be tuned. You will be having lots of knowledge gain through them. And I now welcome Dr. Jatinder Bhatia to take over, and she'll be guiding us how to go for quality standards in medical labs. Dr. Jatinder Bhatia, please.
All of you. Thanks, Dr. Bindu. It was, I must say, a very elaborate introduction. I think you have raised the level of expectation of the audience quite a bit. So I am not that great. I'm a very simple fellow who just likes to interact with people and at different platforms. And especially I'm really enjoying this web platform since this COVID has set in, which is connecting us globally to various regions and various geographies at one time. So it's really pleasure to connect with all of you this evening. And I'll be just briefing you about, what is the importance of 15189 standard, international standard 15189, and what exactly is the standard about, and how we can say that this is one standard which is globally accepted may it be a lab in Canada or Australia or Japan or India, we all are following a particular standard in the same way, and we are all at the same level if we are accredited with this standard. So just getting into the history of 15189, you all know currently the laboratories which are implementing this standard is called ISO 15189-2012. Now, many a times I ask, my students or my colleagues that what is this 2012? So there is a little confusion. So 2012 is nothing, it is the edition of this standard. The latest edition, which we are still following in 2020, is 15189-2012. The first edition had come in 2003. Then the second edition came in 2007. And third edition is 2012, which is still going on for the past 7 years. And we are expecting the next edition any moment, maybe next year or 22. There might be a delay because of this COVID thing, because otherwise it was expected in 21. So before that, before 2003, all the laboratories were following a common standard, which is ISO 17025. ISO 17025 is a standard common for all kinds of laboratories. So same was being implemented in medical laboratories also. Before they realized, no, medical laboratories function differently. So we should be excluding this from 17025, and we should come out with a new specific standard for medical labs. And that's how in 2003, 15189 came out. So next slide, please. So why it became so popular? When it came in 2003, 23 countries around the world adopted the standard within 1 year of publication. So by 2004, there were 23 countries which adopted. By 2009, that is the second edition, was adopted by 44 countries. And in 2013, 60 countries adopted this standard. So you can say that this was the fastest growing international quality standard in the world. Accreditation in most of the countries is voluntary, but yes, in Western countries, if you talk about Canada or you talk about Europe, it has become mandatory over there. So when you have to open in a private sector laboratory and the laboratory has to function for the public, it is mandatory that it should be accredited by specific guidelines of this standard. Next slide.
Yes, I have already changed.
Yeah. So why ISO 15189-2012 is a special standard? It's a single document, not a very big document. It's a single small booklet which is accepted word over, and it unifies the efforts to improve the patient care. It has evolved out of ISO 9001 and ISO 17025, which were those standards earlier. It doesn't require re-accreditation if the lab changes its methods. ISO publishes the document in multiple languages. So that is also one reason for acceptability. It can be used by authorized accreditation organizations anywhere in the world. It allows other accreditation bodies to adapt ISO 15189 to local circumstances. Like if I talk of India, so in India, we have a local, or you can say Indian document known as NABL 112, because our body which accredits here, the Indian laboratories, is called as NABL, which is National Accreditation Board of Laboratories. And same way in different countries, there are different labs which are or there are different accreditation bodies which are named differently, but they are doing a similar work, that they are accrediting their country's clinical laboratories based on ISO 15189 standard. So all countries have their local documents as well. A global perspective, you can see that there are plenty of countries which are following this particular standard, and there is acceptability all over. So this is again a very common question which is asked, or common dilemma which people don't understand, that what is the difference between certification and accreditation. So when we say certification, so certification is assessment of an organization to ensure whether it is meeting the management requirements or not. So when I say management requirements, which are general for any organization, general in the sense that what is the legal entity of our organization, how they are purchasing, how they are lodging the complaints, how they are taking corrective actions, how they are auditing, how they are doing management reviews. So certain things which are not specific to any particular industry, and they are common for any type of industry. And the example is ISO 9001. So you must have heard that this so and so organization is ISO certified. You know, ISO certified means most of them have management criteria fulfilling the requirement, and it is under ISO 9001. Accreditation, when we say, the major difference is that accreditation, under accreditation, the assessment happens for management as well as for the technical operations. So this is very important. This is where the medical labs, they differ, because for us, technical operations or technical competence of a lab is very, very important. So when we say accreditation, it's a combination of both management as well as technical competence of the lab. Next. So accreditation for 15189 means it's a procedure where an authoritative body, and that body can be any authorized body of that country to do that particular assessment, gives formal recognition to a lab or to a person who's the signatory for that lab to carry out specific tasks, which are called as scope. So whatever test a particular lab is doing or is applying for accreditation, they come under scope. And accreditation is given to a combination of the laboratory having premises, having machinery, having a particular kind of layout, to the signatory who are the authorized people to sign the reports, and the scope or the test which they are performing. So actually the accreditation is to the tests ultimately, which are performed by certain people on certain machines. So what it endorses is that the lab is operating effectively the management systems, and it is also operating effectively the technical systems in a particular lab. So accuracy of report, precision of report are much more important for us than only management requirements. So whatever best we do in management, if our reports are not correct, it is of no use. So accreditation insists a lot on the quality and the accuracy of the reports. So when we say globally we are connected, we have a parent body, which is International Laboratory Accreditation Corporation, under which come the Asia Pacific body and the European body. And under those, there are multiple countries which are connected to them. And these countries sign mutual recognition agreements with each other. We call them MRAs. So these MRAs are signed by these countries to come on one platform where their reports are acceptable to each other. Because a lot of research work is happening, a lot of movement of samples is happening from one country to another country. So how do you assess, or how do you say that, yes, there are uniform methods or there is uniformity in the accuracy of these laboratories? For this, it was important to have a standard which is uniformly followed by all the countries. So this ILAC basically is the parent body which develops the principles and the practice of lab accreditation. It harmonizes the procedures and criteria of accreditation. It assists in development of new programs, facilitate mutual recognition of member programs. So naturally, if all of them are members of ILAC or are connected to ILAC, so they have a common platform to exchange their agreements. It reduces the technical barrier in trade, which was the main reason why the standards came into practice, that yes, there has to be a global uniformity, and to improve the international acceptability of the test results. So this diagram shows basically bilateral mechanism of mutual recognition agreements. And these MRA evaluations, whether a particular accreditation body is a part of MRA or not, will also be evaluated. So it is not the laboratory who has to follow a particular standard. Even your accreditation bodies also have to follow a specific standard, which and they have to be assessed time to time so that they can be a part of MRA. So they also have to undergo assessments for 5 days. They also have to show their competence, how in their particular country they are assessing and they are accrediting the labs. So they also have to undergo all this process. Next. So usually the laboratories are differentiated into 3 types of laboratories: small, medium, large, depending upon the load of samples do they have. And this importance is because there are not that the standard is different, but maybe the requirement of assessment becomes different, that how many number of assessors, how much fees is required for a particular laboratory. Next. So you would say how a particular accreditation body can check the competence of a lab. They come just once in a year, come and assess few things on the spot, and that's all. No. One very important part of this competence check is evaluating the results of particular test through proficiency testing. So that is how we always say that if you are thinking of applying for accreditation, or if you are thinking even that your lab should be quality, participate in the external quality program or proficiency testing, because that is the platform where your lab is assessed against so many other labs and it is externally compared. Your results are compared with the labs globally. So you have to participate in certain programs and then you have to ensure your competence and quality in your testing measurements. This is a diagram showing what an accreditation body does. Next. These are few standards which you should be aware of, because they are directly indirectly connected with 15189, that is 17043. So when you are participating in an EQUAS program or a proficiency testing program, just make sure that that body who's providing you the EQUAS platform is accredited by ISO 17043. 17011 is the standard which your accreditation body follows. So currently, if we talk about India, so it's a government regulated body, but in many countries, there are private bodies which are acting as accreditation bodies. So just ensure that they follow the standard 17011 and they have MRA signed and they are ILAC approved. 17000 is conformity assessment. 17025 is again important, that all your calibrations of all your equipment should be done from the laboratories which are accredited by 17025. And of course, 15189 is for the medical laboratories which you are interested in. Next. So this is about the accreditation body. As I told you that ILAC is the parent body, then comes APLAC. Under APLAC, every country has their own body. And in India, it is a statutory body and established by Act of Parliament. It is a not-for-profit organization, third-party accreditation body, and internationally recognized through MRAs. So when we say third party, that means that it has directly nothing to do with the labs. It is not involved in providing the facility, or it is not taking the services of the laboratories. So it is like an outsider coming and assessing your lab. So what an accreditation body does is that they promote the development and maintenance of good practice in testing and measuring within the country, and they keep their own platform also recognized internationally to be a part of the MRA. These are various testing laboratories which come under National Accreditation Board of Laboratories. Medical is a part of it. Next. So just a little bit about what exactly 15189 does. This was more of a history and its global perspective. So if you see this diagram, this diagram shows the cycle of the sample, that there is a patient, doctor has written orders, written tests, blood is collected, then transported to the laboratory, analysis happens in the lab, then data comes into the hands of the pathologist or biochemist or microbiologist. They interpret the results, and then it goes to the physician back, and he treats the patient according to the diagnosis made and based on the results which he has received from the lab. So this has three parts: pre-analytical, analytical, post-analytical. So this is the first step which every lab needs to understand, that it is not only the analytical part which is your role. Your role is to take care of pre-analytical as well as post-analytical. If you have not received the right sample in the laboratory, you can't blame others. It's your responsibility to train the whole chain of people who are involved in the pre-analytical handling of the sample, right? And if you see statistically, 70% or even more, problems happen in the pre-analytical area. And over a period of time, what is happening? The movement of the sample is increasing. There are collection centers, there are network labs, sample is moving from one place to another, to one country to another. So issues in the pre-analytical areas are increasing. Whereas in analytical area, what is happening? A lot of automation is coming. So the chances of errors are decreasing in the analytical area of the lab. So your focus has to be equally there in the pre-analytical area. Post-analytical area, of course, if you have done the reporting and it has not reached into the right hands at the right time, then what is the use? What is the fun of doing that report which has not been used at the right time? So how it has to be interpreted, how it has to be conveyed to your physician is also your responsibility. So from taking the sample till the action happens on the patient back, this whole circle is the responsibility of the lab, right? So repeated trainings, repeated feedbacks from your physicians, from your employees, from your phlebotomists is very, very important, which will help you improving the outcome of the laboratory. And slowly you see, as the tests are developing, more and more high-ended tests. For example, if I tell you about the genetic testing, the lab where I'm tests are so much evolved, or you can say so much high-ended, that probably every oncologist has to discuss even before prescribing that this is the situation of the patient and this is the stage of the patient, which test would help me, because the tests are becoming complicated. So constant interaction with the user of the laboratory is very, very important, right? Next. So on the whole, if you see that this standard 15189, every line, every word of this standard is meaningful. It's a small book, but it has described everything so clearly, and there is not even a single sentence which you can ignore, right? So how you have to manage your staff, how you have to manage your customer, how physically the lab has to be handled, how the quality part of the technical area has to be handled, and how you have to do error improvement. All these things are covered in the clauses of the standard, and they all put together make quality of the laboratory. This is just about the standard. As I told you that there are management requirements and there are technical requirements, and under the management requirements, there are 15 clauses, which even if I narrate quickly, you are not going to remember if you are going through the standard for the first time. But yes, these are very, very important. And these are the clauses which one by one, when you start implementing an ABL or you start implementing this standard in your laboratory, you have to follow every clause, and in detail, you have to take actions as per these clauses. So I'll just quickly go through. It is organization and management responsibility, quality management system, how you are going to control your documents, how you are going to make agreements with your users, how you are going to deal with the outsourced labs where you are going to send the samples, how you will handle the purchase of your equipment and your supplies, what should be the advisory services available in a lab when a patient or a consultant asks any questions or has a query, how will you resolve the complaints, how will you identify the non-conformances happening in the lab where the things are not happening as per the guidelines, and what kind of corrective actions you will take, what kind of preventive actions you will take, how will you set the standards and the protocols for a continuous improvement in the lab, how will you control the records, and the last two clauses very important, how will you do the audits, which is like time to time assessment of the laboratory, and how the management will review the whole thing and suggest you the methods of improvement and will evaluate that the goals which they have set in as quality policy, they have been achieved or not. So same way there are technical clauses. So these are not management, this is a mistake here. These are technical clauses. And in technical clauses, there are 10 clauses where we look at the personnel, about the qualification, about the competence of the personnel, how the accommodation and the environment of the lab has to be maintained, equipment, reagents, consumables, which are of course the main ingredients of a lab. Then pre-examination processes, which covers, as I told you, the whole pre-analytical gamut of events, starting from the sample prescription to the sample entering into the lab. Then the processes happening in the lab. Then quality controls, internal quality control, external quality assurance programs, proficiency testing, lab to lab comparisons, equipment to equipment comparison, method to method comparisons, all these things to ensure that you are getting the reports which show good precision and accuracy. Then post-examination processes, after the examination is over, how the report is delivered, to whom it is delivered, how it is interpreted. Reporting of result, release of results, and lab information system. So this covers the technical requirements of the standard. This is just about audit because it is a very, very important, you can say, event in the process of accreditation. When we say audit, so it can be an internal audit, it can be external audit. So this audit is not like an examination. This is a very systematic and documented procedure or process, I should say, which is to obtain any evidence that is this particular lab fulfilling the standard criteria or the criteria laid down by the standard or not. So time to time audits, internal or external, which is done by your accreditation body, they are supposed to happen. So whenever you are implementing the standard, after implementation, do internal audits. And that is the focus of our training also. The two parts, how quality management, what exactly is quality management system, how you are implementing in your laboratory, and then how you are auditing. If you don't do audit, you don't know what you are doing. So very important that you keep doing internal audits and keep assessing yourself, keep coming out with non-compliances, keep improving them, right? So audit can be by yourself, audit can be by your user, and audit can be by third party. Third party is like your accreditation body. So audits are very important part of the quality improvement. And all our trainings focus on these two parts only, quality management system and its audit. Next slide. So this is just a procedure which is being followed, I suppose, all across the world. The procedure majorly remains the same, that once you have implemented the system, you have done the internal audit, you have done the management review, then you can send your applications to the accreditation body. They will appoint the assessors for you. Those assessors will come, physically verify all the claims you have made in the application. They will come, they will see what is being done as per the standard and what is not as per the standard. So they just follow the checklist given by the standard and see where you're complying, where you're not complying. And all those non-compliances are given to you, which you have to fulfill, and then you are given the certificate or you are given the accreditation by the accreditation body. So as a process, it is not a very complicated process, but yes, it takes its own time. Usually the whole thing, starting implementation and audit, will take around 3 to 5 months to reach the level of certificate. Next slide. Yeah. So this was just about the whole global perspective, that what this standard is and what is the use of it. And now I will request Dr. Ratan to please take over and discuss further, what can be the various methods, how the accreditation can help, and how, internationally, not only in India, because I can see there are audience from Dubai and also from Africa, that how we can help these countries as well for the accreditation processes, or even for you can say step less than that, because the purpose is not accreditation, the purpose is quality. The purpose is implementation of quality. So how different steps can be taken? So over to Dr. Ratan, please. Thank you so much.
Thank you, ma'am. And may I have the first slide, Miss? We have gone through the steps of ISO 15189, and I think for lab persons, it doesn't need to much reiteration that there are ample benefits of going in for accreditation. Let me reiterate that because ISO 15189 accreditation program contains both management obligations and specific technical requirements to ensure overall compliance in performance of the medical diagnostic services. That is the first benefit. Second is that running an efficient management system reduces risk and improves patient safety through implementation of tools to measure and mitigate risk. Third, a quality management system can foster healthcare reforms and provide an environment in which staff can perform to their best potential. Staff contribution, involvement, and professionalism is encouraged and morale is improved. Fourth, clear documentation of process and procedures results in improved communication and reduces variability, which is the bugbear of quality. Fifth, ISO 15189-2012 is recognized worldwide as a mark of excellence, fostering competitiveness and assisting facilities to expand their business. Sixth, ISO 15189 accreditation is carried out by peers who have hands-on experience in running and managing an accredited laboratory. Seventh, it demonstrates investment in a structured accreditation program, demonstrates a solid commitment by the management to provide the best quality services and accountability to patients, governments, and regulators. This is a clear sign that its diagnostic services can be trusted. Eighth, accreditation cycle encourages continuous review and maintenance of documents and processes. Momentum is never lost for improvement. Ninth is accreditation process provides an opportunity for a service to be scrutinized by different eyes, providing different perspective to cultivate fresh ideas to improve overall systems. And working as an assessor would offer a unique opportunity to observe alternative approaches. So the benefits are obvious and many. However, the ground reality is, next slide, please. In India, though it is guesstimated that there are 100,000 laboratories, only 1,000 laboratories were NABL accredited to ISO 15189. That means, if my math serves me right, 1% of the total laboratories were accredited. In Africa, though it is endemic for malaria, TB, and HIV, and outbreaks of Ebola, dengue, hemorrhagic fever occur every year, the total number of laboratories are not documented anywhere. And it's been indicated that less than 400 laboratories are accredited. 91% of these laboratories are in South Africa. In sub-Saharan region, 37 out of 49 countries have no accredited laboratory. Being in India, we normally inquire more from Indians on why they have not gone in for accreditation, and the excuses or the explanations mentioned are that their lab is very small, they do only simple tests, accreditation process is very tough, it is costly, and it's time consuming. Next slide, please. In Africa, in 2011, the ministers met and decided that they should, instead of going in for only ISO 15189, which should be the accepted international standard, but they would set up a guide for stepwise laboratory quality improvement process towards accreditation. They call that a SPLITA in the WHO African region. CDC and WHO helped the countries, and they set up this consisted of setting up a checklist which was revised in 2015. Next slide, please. Every step has been given points, and out of 275 points, depending upon how many after an audit a lab gets, it is then awarded stars. So if it is 55 to 64%, it's 1 star. If it is below 74%, it is 2 stars. Below 84%, it's 3 stars and 4 stars. And if it is more than 95%, then it is given 5 star and is encouraged to go in for ISO 15189 accreditation. This started in 2011. In 2020, you find that the situation has not really changed tremendously. The labs are more labs are accredited, definitely, but there are more in South Africa and a few spattering of countries in the rest of Africa. Next slide, please. So in India, NABL took a different view. It encourages labs to participate in proficiency testing. And this proficiency testing should be provided by an accredited proficiency testing provider. If that is there, they set up a system in 2019, 4th February 2019, for medical laboratories. And they said that this is for one cycle for 3 years. So you can be recognized. This is not accreditation, this is not certification, this is recognition. And they said you could be recognized for 3 years. The criteria for eligibility is that you should be satisfactory participation in proficiency testing conducted by an accredited PT provider. The test parameters covered in the last 6 months in PT program would be up for recognition, and the lab should continue for another year to participate in the same PT program. This does not involve an on-site visit at the initial, but during the next 3 years that the lab is accredited, there would be an on-site surveillance visit, which could be conducted at any time. Then the scope, once recognized, cannot be changed during the recognized period of years, and there is no provision for extension of the scope in the scheme. And ISO 15189 accredited laboratory cannot use this scheme. This scheme is meant for those who are not accredited. NABL 128 enunciates the criteria and procedures for NABL medical entry level testing laboratory program, and NABL 155 gives the application and the checklist that you could use for filing this application. Next slide, please. The process here is slightly different in the sense that laboratory files an application as per ISO 155, which would then be, they would do geotagging of the laboratory. The laboratory, when it files the application, it will give the name of the laboratory, the location it is there, whether it is registered with the CMO, whether it has pollution control registration, then whether it has a registration with biomedical waste, and of course, what proficiency testing program it participates in, and the results of at least one cycle. Then, along with the fees, when it gives the application, and this can be applied online, then they would first receive an acknowledgement. After scrutiny by officers of the NAL, they would then be informed whether it's been recognized or not, and they would recommend for recognition by review committee based on satisfactory PT performance. And if it is approved, then you would get a certificate. After you got the certificate, it is valid for 6 months. Sorry, it's valid for 3 years. And during these 3 years, anytime during these 3 years, there could be an on-site surveillance visit. During that time, there would be scrutiny of assessment report. There would be recommendation for continuation of recognition by the review committee and approval for the decision, and again, online issue of certificate would occur. The laboratory has 10 days to, in the initial part, the laboratory has 10 days to respond, and subsequently, if NCs are found on surveillance visit, then laboratory close the NCs in 30th. Then terms of conditions have been laid out that the laboratory should meet the requirement of the regulators. The laboratory should meet the criteria as defined in clause 2 of the document. The laboratory should offer cooperation to NABL or its representatives in undergoing assessment. Following, whenever NABL considered it as necessary, access to all laboratory areas of operations, undertaking any assessment to verify the capability of laboratory for applied scope, witness the activities being performed relevant to the scheme, assessing the competence of the staff during the assessment, assessed access to all relevant information, documents, and records, etc. Next slide, please. The lottery should pay the stipulated fees to NABL, and that has been now revised to 15,000. If performance in two successive PT samples for the same parameter is not satisfactory, the laboratory should be re-recognized for that particular parameter. The laboratory should not involve in any kind of activity which may bring NABL to disrepute. The recognition of laboratory can acknowledge recognition through a written notice to NABL by clearing any outstanding payment and surrendering the certificate along with scope. So the parameters mentioned, the test that it is included in the parameters are routine biochemistry like sugar, the KFTs and LFTs, and hematology would be hemoglobin and the CBCs. Clinical pathology will be urine and stool examination, and they could be rapid tests for malaria, for typhoid, for HIV, for rheumatoid factors, etc. So those are the normal scope of the tests that a person can perform, and there will be listing of the equipment as well as performance in the PT for at least one cycle. For the last 6 months, a person must participate in the proficiency testing and get good results in that. Next slide, please. De-recognition of laboratory can occur when the laboratory does not participate in PT program conducted by accredited PT provider. After its recognition decision, PT performance is not satisfactory in 2 consecutive PT samples, when laboratory does not undergo on-site assessment, when laboratory has not taken adequate corrective actions, when laboratory has not paid the fees, any violation in terms of conditions, when laboratory withdraws recognition by giving notice in writing to NABL. Next slide, please. And once all the criteria is met, as you notice, that it is providing you an opportunity to participate and encouraging you to participate in proficiency testing. And once you do proficiency testing, you get this certificate and you get 3 years to get ready and going for ISO 15189. I hand you back.
I think Dr. Ashok Ratan has done a very beautiful job of explaining us how it can be onto a global level, what are the problems and what are the challenges to be faced and how to resolve it. Thank you so much, Dr. Ashok Ratan and Ma'am Jatin Bhatia. Both of you have explained us very beautifully that what is ISO 15189, what are the consequences, what are the benefits of it, and how to go for it with the quality systems to be implemented in our labs. So taking it one step further, taking it one step forward, now let me make you understand, all of you. I think the crowd which I am facing today is global, and all of you are into the field of medical laboratories somehow. Somewhere you are related, either you might be a student coming to the field of medical laboratories. It may happen that you are already a doctor or running a laboratory and you are a quality manager or anybody. As far as you are connected to medical laboratories and looking to improve your labs, you are onto the right platform. Improve, I am not just talking in the case of just implementing and getting accredited to NABL or any of your body. By implementing, by improvement or quality system, what I mean is that we are improving your last level up to your bottom level, your working system, your proficiencies and your progress of your work. So it completely changes the quality system of your lab. Now that is possible only when you're the staff or the people concerned with the quality of the lab are taking the trainings and they know what is ISO 15189 standards, how to do it, what is ISO standard, when to implement, where to implement, and the handholding complete. Now that is where 360 is entering into this field, and we are doing the handholding of all the organizations or personnel who is going and looking for the quality standards of labs. So we have got a program of training program which goes for everybody. Like it is for the 4 days program, completely online program. Out of that, 3 days, first, second, and third day, we are having in self-explanatory videos delivered with the faculty, a very experienced faculty, and she explains clause number 4 and clause number 5, both of them very widely with examples and how to process for it. And secondly, once you're done with 3 days program on your own place, the plus point in this is because it is an online program, you can do at your own pace, at your own requirements, and at your own place, wherever you are situated. So that is a plus point of this particular program. As well as we have taken care that on the 4th day, whatever queries you have got in your mind when you are going through this 3 days program is resolved practically, and we are coming with a live on 4th day. The faculty who is giving you a lecture, for 3 days you have attended videos, you understand what is what, and after this you can just note down your queries and it will be resolved on 4th day on one-on-one basis. That is an advantage of 4th day. 4th day we gave mock audit also. So you literally feel that you are entering into the field of audit and how to handle your audit onto a practical base. So the third thing is we do have a one-on-one faculty to go for, which is an industry expert, and they clear out all your doubts, whatever queries you have. And it also includes your classroom workshop and test for certification. So you have to give your online test also, and that will fetch you and certificate that you are ISO certified 15189 internal auditor. Now this is our 4 days flagship program of 360 Help, which is encouraged, and I'll ask all of you to go forward and look at it and go for registration and have a look at it, that how it goes for. Now, who should do it and why you should do this training? There are important reasons. Already our speakers have given us well. There are so many benefits of going for ISO 15189 standard implementation. It will completely improve the quality of your labs. This training of quality is needed mainly for first is quality managers. Quality managers of lab, if he is trained and if he trains the staff below him, naturally the effects are going to be fantastic. It is useful and essential for understanding the international standards. It is useful for pathologists, it is useful for microbiologists, biochemists, technicians, everybody. So whoever is connected to medical labs, either you may be a lab technician, maybe a quality manager, or maybe you are just a graduate coming out of the college and looking for the entering of the medical labs, will give you an added advantage that you already know the standards to be implemented into medical labs. So that is an advantage. If you are working professional, then also you should be knowing it. All doctors and lab technicians should be knowing it. So to avail benefits of ISO 15189, we will suggest that it is a better option and better choice given by 360 on a global level, that where we introduce ourselves as a training provider on ISO 15189, which will take your standards up by one level. These are some of the examples and teams which we have done 200 plus more than programs of training, which is just speaks by itself that what is the work and delivered by the 360 members and 360 staff. So with this, we are concluding our today's session on ISO 15189, and we are looking forward to give your feedback and give us a chance to improve ourselves. But by listening to the complete program of today and giving your feedback will ensure that we are giving you an e-certificate on the basis of this, that you have attended ISO 15189 global webinar. Thank you.